Emogram Open.
The current case fatality rate, it demonstrates, in fact, probably much more the true case fatality rates of this very lethal pathogen. It also shows that people have a bad access to treatment centers for different reasons. So either if they're sick, there's no treatment center available, or they cannot reach it due to security issues, or it's too far away. And then they come, for example, in a very late state. So
et qu'on en a besoin, on les donne le plus.
Well, the outbreak, so it has been detected very late. Probably cases have been going on already since probably January, February. Probably it started in Mongwalu. But then before the outbreak was confirmed, the 15th of May, the outbreak had spread already in big parts of Ituri and in other provinces of Congo. Then there's so many cases, there's so many patients, there's so many needs to have Ebola disease beds, Ebola treatment centers. Besides that, there's high need to engage with the community so that people understand what is the disease, they accept to come to the Ebola treatment centers. So in fact, there's a need in a very large geographical area. And so activities have been scaled up, but it's still not sufficient. We are still running behind the epidemic. It's still very high, intense transmission.
Currently, WHO is aware that 13 cases of Ebola have been confirmed by INRB in Kinshasa. And on the 5th of May, WHO received a signal of suspected cases and sent a team to Ituri to support DRC health officials in their investigation of the outbreak and collect samples in the field, which initially tested negative for Ebola.
So the actors, the Ministry of Health and the supporting actors, they're just completely stretched in human resources in being able to go to all these places. So the focus has been now in the most hotspot areas, but the outbreak is spreading. And in case there's no intervention in the areas where the first new cases are, these areas can become another area of very intense transmission with many, many cases. So it's a very challenging outbreak. And yeah, still we need much more bed capacity, much more actors jumping in. So we are still far away from controlling this outbreak. Because that's also one of the reasons why probably now we have getting better data. So because there's more laboratory testing available, but it's still largely insufficient because the outbreak is everywhere. But this helps also in the Ebola treatment centers to identify if someone has the disease or not. And if not, then a bed can be freed up for other patients that can be tested for the disease.
L'effet de pouvoir voir parmi les fenêtres, ça veut dire qu'on peut mettre un internet, récupère les PCR utilisables et les restes.
So people can recover. Of course, we're working on vaccines and treatments, but that doesn't mean that people cannot recover from Ebola.
So the main focus in the last year since the West African outbreak has been on this other virus. And now we have the Bundibugyo virus outbreak, which have been rare outbreaks before, only 2. So there was no research in advanced stages to add additional control strategies now to the outbreak control strategies. So it is not surprising to have a high case fatality rate. It could be reduced. It could be reduced if patients could come earlier, because the earlier people come, the more you can do for them. And we are all hoping that now with the trials that are underway, that maybe we will have a bit more specific treatment for this Bundibugyo virus that could reduce the mortality. But most likely also then people need to come early, otherwise these treatments may also not be helping to reduce the mortality.